Good morning, everyone. I'm Dana Corson, a media officer with the National Academies of Sciences, Engineering, and Medicine. Thank you for joining us this morning for a webinar on the report that was just released titled Public Health Consequences of E-Cigarettes. You may now download a copy of the report and other supporting materials at nationalacademies.org/e-cig health effects. And a recording of this webinar, as well as the slides that will be presented today, will be available on that URL as well. And you can follow the conversation about the report on Twitter or other social media at #eCigHealthEffects. For those of you not familiar with the U.S. National Academies of Sciences, Engineering, and Medicine, we are private nonprofit institutions that provide independent, objective analysis and advice to the U.S. to solve complex problems and inform public policy decisions related to science, technology, and medicine. The National Academies operate under a congressional charter to the National Academy of Sciences that was signed by President Lincoln in 1863. For each requested study, panel members are chosen for their expertise and experience and serve pro bono to carry out the study statement of task. The reports that result from the study represent the consensus view of the committee and must undergo external peer review before they are released, as did this report. I have with me several members of the committee to discuss the report's findings and recommendations, but before I introduce the committee, I want to go over a few technical reminders. After the opening remarks, we will begin to take questions through the Q&A box located in the lower right-hand corner of your screen. Simply type your question in the box at any time and click Submit. We ask that you leave the box set to send your questions to all panelists and that you identify yourself and your organization when asking a question. If you have any technical issues during the event, please contact the WebEx technical support. I'm going to give you their phone number. It's 1-866-229-3239. And now, I'd like to introduce the members of the committee who are here with us today. We have Dr. Dave Eaton, chair of the committee. He is Dean and Vice Provost of the Graduate School and Professor of Environmental and Occupational Health Sciences at the School of Public Health at University of Washington in Seattle. We also have Dr. Maciej Gonowicz, Associate Professor of Oncology in the Department of Health Behavior at Roswell Park Comprehensive Cancer Center in Buffalo, New York. And we have Dr. Adam Leventhal, Professor in the Departments of Preventive Medicine and Psychology and the USC Norris Comprehensive Cancer Center at the University of Southern California in Los Angeles. We have Dr. David Mendez, Associate Professor in the Department of Health Management and Policy at University of Michigan in Ann Arbor. Next, we have Dr. Nancy Rigotti, Professor of Medicine at Harvard Medical School and Director of the Tobacco Research and Treatment Center and Associate Chief in the Division of General Internal Medicine at Massachusetts General Hospital in Boston. Last but not least, we have Dr. David Savitz, Professor of Epidemiology in the School of Public Health and Professor of Obstetrics and Gynecology and Pediatrics in the Warren Alpert Medical School at Brown University in Providence, Rhode Island. We'll start off with a presentation summarizing the report, and then we'll open it up for questions you may have. Please note this webinar is scheduled to last 1 hour. And with that, I will turn it over to Dr. Eaton.
Well, thank you very much, and welcome everybody to this webinar. The statement of task given to us from the FDA was to evaluate the available evidence of the health effects related to the use of electronic nicotine delivery systems, or ENDS devices, which we refer to throughout our report as e-cigarettes. A second important charge to the committee was to not only evaluate this evidence, but to identify gaps in knowledge and to identify future federally funded research needs. So what are e-cigarettes? The terminology is heterogeneous. There are a variety of products that we evaluated and a few that we did not. It's important to understand the scope of this report. This focused largely on what we call e-cigarettes or vaping or vaporizers, mods, tanks, anything that contains an e-liquid that is vaporized to an aerosol. It's important to note that while most of these contain nicotine, some may not contain nicotine, so they're not all nicotine containing. And it's also important to recognize that we did not include in this review the more recent heat not burn tobacco products. The report is organized into 3 sections. In the first section, we discuss the nature of e-cigarette devices, the variable types and important aspects of the devices, such as the batteries and the heating elements, etc., the constituents that are present in e-liquids, as well as how those e-liquids are aerosolized and what actually ends up in the aerosol resulting in exposure. So that's section 1. Section 2, then, we dive into looking at what's known about the various types of health effects that could be the result of e-cigarette exposures. And then Section 3, we look more broadly at the public health implications of e-cigarettes, including issues of initiation, cessation, harm reduction, and include some modeling exercises that put all of those things together. The approach to the committee was initially to use largely a systematic review approach for at least for some of the endpoints. We did a fairly exhaustive search of the literature. It's important to know that we had to have a cutoff date for the literature we included in the report, and that cutoff date was the end of August. We looked at a variety of different databases that would contain information, and we found over 4,000 unique records that we felt were potentially relevant to the task. And of those, over 800 were reviewed and included in this report. We looked not only at the results that were presented in these studies, but also did a quality assessment. And the purpose of that quality assessment, of course, was to help us in our approach to assessing causality and synthesis of the evidence. And for that, we categorized for each outcome different levels of evidence and conclusions. The approach to assessing causality basically takes the standard approach of the Bradford Hill criteria for assessing causality. And for the most part, we work backwards looking at human outcomes and human health risks, and then working backwards as you will see in the report, there's not a lot of long-term studies on these devices. Most of them have been around for only 10 years or so. So a lot of the report is focused on more intermediate outcomes and early outcomes, going back into the initial events, including exposures and assessment of exposures to the various constituents that are present in aerosols. The levels of evidence framework we used go from a high level of evidence where we have multiple studies that are consistent, usually involving randomized controlled trials. Moving on down, for the most part, most of the studies did not have conclusive evidence or enough studies for conclusive evidence, as you will see as we go through this, on down the line to substantial, moderate, limited, insufficient, and for a number of outcomes where there is no available evidence. And it's important here to recognize that when we say there is no available evidence, that's not necessarily the same as saying there's no evidence of an effect. It's simply to say there is not evidence to make a conclusion or draw an inference one way or the other. There are lots of different types of devices on the market, and we recognize that these devices have changed their nature and characteristics over the past 10 years. These include vaping tanks, so e-cigarettes, and a variety of different devices, some of those illustrated in this diagram here. Looking at the constituents, and the very first part of our evaluation was to look at what's present in e-liquids, and especially what's present in the aerosols that people are exposed to when using these devices. We found that there's conclusive evidence that most e-cigarette products contain and emit a variety of different potentially toxic substances. The number, the quantity, and the characteristics of these substances, however, is highly variable depending on the nature of the device and the product, obviously what's in the e-liquids, and even how the device is operated and user characteristics. And this variability in exposures represents a substantial challenge in understanding health outcomes. We did find that there's substantial evidence that, at least under the typical conditions of use, exposures to potentially toxic substances from e-cigarettes is significantly lower compared with combustible tobacco cigarettes. These devices are generally designed to deliver nicotine, and we found, in fact, conclusive evidence that exposure to nicotine from e-cigarettes occurs, but it's highly variable, and again, depends on the product characteristics as well as how these devices are actually operated. We found that there's substantial evidence that nicotine intake from e-cigarette devices, at least among experienced adult e-cigarette users, can be comparable to that from combustible tobacco cigarettes. We found that there are a number of different metals present in e-cigarette aerosols, and this is one area where there is some difference from combustible tobacco products, which generally have relatively low levels of metal exposure. And we discussed the specific types of metals that are formed and found that there's some limited evidence that many of these metals are present or could be present at greater numbers both of metals as well as levels when compared to tobacco cigarettes, with an exception there of being cadmium, which is found in most tobacco cigarette smoke. So we will now go into the section on health effects, and I will now turn this over to my colleague, David Savitz.
Thank you. In going over the health effects, we considered all of those that were thought to be potentially relevant, not only the clinical endpoints, but also the pathways related to those outcomes. I won't be commenting on all of these because in many cases there simply wasn't evidence to discuss, but I will be going through the major ones. In the approach to this, as I said, we considered both the diseases, the clinical endpoints themselves, as well as the intermediate processes that can lead to those diseases. We talked about what would be an optimal study design for addressing them. We were limited, of course, by what the literature offers. We could only review what had been done and considered in previous studies. And it's important to note that in some cases, depending on the exact nature of the question, the relevant comparison may be between e-cigarette users and those unexposed to any product, or it may be between e-cigarette users and tobacco smokers as the relevant comparison group. So reviewed the evidence, we synthesized the information, we considered distinctly potentially susceptible populations, and drew conclusions from that. We found substantial evidence that the use of e-cigarettes can result in symptoms of dependence on e-cigarettes, that through the behavioral disorder defined as reliance or dependence on the product. Moderate evidence that this level of dependence may be lower for e-cigarettes than for combustible tobacco, but again, the great deal of variability in the product characteristics, and again, depending on the degree of the amount of nicotine delivered, the impact on dependence would vary as well. For cardiovascular diseases, there's no direct evidence on whether or not e-cigarettes are associated with the clinical cardiovascular outcomes or even subclinical outcomes like atherosclerosis. There is substantial evidence of very short-term physiologic changes that would be, of course, expected with nicotine, including increased heart rate. There's moderate evidence for diastolic blood pressure increasing. And there is some limited evidence of other physiologic changes, again, related to nicotine, but insufficient evidence to assess whether e-cigarette use is or is not associated with long-term changes in these physiologic parameters. Next. For cancers, there is limited evidence from animal studies that some of the biomarkers that are associated with the development of cancer are increased by e-cigarettes, but there's no available comparable evidence on whether or not e-cigarettes change those same intermediate cancer endpoints in humans. Again, no available evidence from long-term animal bioassays There is, however, it's important to note, substantial evidence that some of the chemicals that are present in the aerosols are capable of damaging DNA and causing mutations. It's currently unknown whether those levels are high enough to actually contribute to disease in humans. For respiratory disease, again, there's no evidence directly on whether or not e-cigarettes cause respiratory disease in humans. There is moderate evidence that adolescents who have asthma or they're more prone to symptoms associated with the use of e-cigarettes, with cough and wheeze. There's limited evidence on effects in animal studies, in vitro studies. And there is some limited evidence that tobacco smokers who switch to e-cigarettes who have underlying diseases of either asthma or chronic obstructive pulmonary disease may be able to reduce their symptoms in response to that change from tobacco to e-cigarettes. There's conclusive evidence that these devices can explode and cause burns and projectile injuries. This is really from just case reports and individual episodes. And especially this is a risk when the batteries are poor quality or stored improperly or modified by users. And there's also conclusive evidence that the e-liquid products themselves, in the case of either intentional or accidental exposure to drinking or eye contact, dermal contact, can cause adverse health effects, and in extreme conditions can even be fatal. I'm going to pass it along next to my colleague Adam Rosenthal, who's going to speak to the public health implications of e-cigarettes.
Thank you, David. So this is Adam Leventhal. So this section on public health implications of e-cigarettes focuses on the effects in the overall population. It considers a complex relationship between e-cigarette use and combustible tobacco cigarette use. And it considers them and the role of e-cigarettes in several populations, including the role in smoking amongst youth and young adults, the role of smoking cessation among adults. It also considers harm reduction, including the health effects of switching from combustible tobacco cigarettes to e-cigarettes, and a head-to-head comparison in the risk profiles of the two products. And then it also includes a modeling study that we did that included the evidence from the entire report to make projections about the potential health effects of e-cigarettes in the population. So the first conclusion was that we found substantial evidence that e-cigarette use increases risk of ever using combustible tobacco cigarettes amongst youth and young adults. We found 10 longitudinal cohort studies, and in all 10 of them, amongst youth and young adults who have never tried a cigarette before, those who used e-cigarettes were more likely to go on to become ever smokers, which we define as using a cigarette at least once or more in their lifetime. And the evidence was consistent across a number of different methodologies, age ranges, research groups, locations, and the associations were of considerable strength. There was also a supplementary evidence base, most of which reinforced this conclusion. The public health implications of this finding are questionable if youth who begin with e-cigarettes and then transition to trying a cigarette at least once are overrepresented by those who are temporarily experimenting and do not progress to become more regular smokers. And what we found was a smaller evidence base that addressed this question, and the finding was that amongst youth and young adult e-cigarette users who are ever combustible tobacco cigarette smokers, there was moderate evidence that e-cigarette use increases the frequency and intensity of combustible tobacco cigarette smoking, intensity being the number of cigarettes smoked per smoking day. And there was also limited evidence that e-cigarette use increases in the near term the duration of subsequent combustible tobacco cigarette smoking. It's important to note, however, that each of the studies reviewed have brief follow-up periods from 12 to 18 months, and it's unclear whether these trends will translate into longer periods of follow-up. And with that, I will transition to Dr. Nancy Rigotti, who will talk about cessation.
Thank you. E-cigarettes will have the greatest benefit to both individual smokers and to the population if they help smokers to quit using combustible tobacco products, especially if they help smokers who would otherwise be unwilling or unable to quit using current evidence-based tobacco treatment. The committee reviewed the evidence about whether e-cigarettes help smokers to quit. And in doing so, we defined quitting as abstinence from conventional tobacco products, but did not require abstinence from e-cigarettes, so that an e-cigarette-only smoker would still be, or user, vapor, would still be considered abstinent from tobacco or quit from cigarettes. The committee found a small and heterogeneous evidence base consisting of essentially 3 randomized controlled trials, a larger number of longitudinal observational studies, and some population studies, most of which were cross-sectional in nature. We also identified 21 systematic reviews of this relatively small body of evidence. Our analysis gave priority to the randomized controlled trials, but considered the totality of evidence. Overall, what we concluded was that there's limited evidence that e-cigarettes may be effective aids to promote smoking cessation overall. If we dial down to the greater details, there was moderate evidence from randomized controlled trials that e-cigarettes with nicotine are more effective than e-cigarettes without nicotine for smoking cessation. That's not a surprise given what we know about nicotine replacement products and their efficacy. There was, however, insufficient evidence to help us with the more important question for public health, to know whether or not e-cigarettes are as or more effective as cessation aids compared to no treatment or to FDA-approved smoking cessation treatments. And we see this as a major major gap in the evidence that requires further research. In addition, from the observational trials, we found moderate evidence that more frequent use of e-cigarettes is associated with increased likelihood of cessation compared to the intermittent or dual use of e-cigarettes. I'll now turn it over to talk about harm reduction from my colleague, Dr. Maciej Ganowicz.
Thank you so much, Nancy. So during our work, the committee decided to put the context of electronic cigarettes and compare them to tobacco cigarettes and devote a separate chapter in our report that would compare relative toxicity and relative health effects of electronic cigarettes to those caused by conventional combustible tobacco products. And we use exactly the same approach that we use for the whole report. So we look at the health effects, we look at the study, observational study, randomized controlled study, and cross-sectional studies with the human subjects, especially smokers who switch from tobacco products to electronic cigarettes. As well, we evaluated studies looking at the in vitro toxicity and composition of the chemicals present in tobacco smoke compared to those reported in aerosol emitted from electronic cigarettes. And when we look at the evidence of the complete switching, so in those smokers who substituted those conventional combustible tobacco cigarettes with electronic cigarettes, we found strong evidence of reduced harm among those who switch completely. The committee made a conclusive statement, conclusive evidence that completely substituting electronic cigarettes for combustible tobacco cigarettes reduces users' exposure to numerous toxicants and carcinogen present in combustible tobacco products. We also found substantial evidence that completely switching from regular use of combustible tobacco cigarettes to electronic cigarettes results in reduced short-term adverse health outcomes in several organ systems. As for the whole report, we have a limited evidence on the long-term health effects. We also look at the effect on the dual use, so those smokers who add electronic cigarette or reduce smoking by using electronic cigarettes, and here the evidence were not so strong, with little to no evidence of reduced harm among dual users. The committee concluded that there are no available evidence whether or not long-term electronic cigarette use among smokers, dual users, changes morbidity and mortality compared with those who only smoke combustible tobacco cigarettes. We also found insufficient evidence that electronic cigarette use changes short-term adverse health outcomes in several organ systems in smokers who continue to smoke combustible tobacco cigarettes, so-called dual users. And we also look at the secondhand exposure to aerosol emitted from electronic cigarettes and compared to those emitted to environmental tobacco smoke emitted from combustible products. And the committee found that there are conclusive evidence that electronic cigarette use increases airborne concentration of particulate matter and nicotine in indoor environments compared with background levels. We found moderate evidence that secondhand exposure to nicotine and particulate is lower from electronic cigarettes compared with combustible tobacco cigarettes. And now I will turn to my colleague, Dr. David Mendes, who will present the results of the modeling.
Thank you. The committee used the established model of smoking prevalence and health effects to evaluate the overall impact of e-cigarettes on mortality over the period 2015 to 2050 and 2015 to 2070 under different assumptions regarding the effect of e-cigarettes on smoking initiation rate, smoking cessation rate, and the relative harm of e-cigarettes compared to combustible tobaccos. The outcomes, again, were the life year loss or gain because of e-cigarettes during those periods. This is an example of the output from the model, and where you can see that the red colors represent net benefits and the blue colors represent net losses. So, for example, if e-cigarettes increase smoking initiation by 5% and smoking cessation by 15% from 2015 on, there will be, by the year 2050, 3.1 million of life years gain because of e-cigarettes. On the other hand, if e-cigarettes increase the initiation rate by 50% and decrease the cessation rate by 5%, there will be a 9.3 million life year loss because of e-cigarettes by the year 2070. This output considers that e-cigarettes are 10% the risk of combustibles. We try different values ranging from 0 to 50%. So the next slide. Here we present the same kind of scenarios, but now considering that e-cigarettes carry 25% of the risk of combustible. So the output is pretty much similar to the 10%, but we see now that the benefits are a little lower because of the increased initiation at the effect of initiation in the year 2070 and 2050. In all scenarios where e-cigarettes increase the smoking cessation rate, the modeling projects that the use of these products will generate a net public health benefit, at least in the short run, by the year 2050. Because of the harms of increased initiation will take time to manifest, occurring decades after the benefits of increased cessations are seen. For longer range projections, for example, 50 years out, the net public health benefit is substantially less and is negative under some scenarios due to the harms or increased initiation. So if e-cigarette use does not increase the smoking cessation rate, the model projects that there would be a net public health harm in the short and long term. Now, what parameters are likely, some of the parameters are more likely than others. So while there's uncertainty about the relative harm of e-cigarettes and their effect in initiation and cessation, the available evidence suggests that, one, e-cigarettes are likely to be substantially less harmful than combustible tobacco. e-cigarettes are not likely to increase the smoking initiation rate by more than 10% and probably substantially less. And e-cigarette use is likely to increase the smoking cessation rate within the 5% to 15% range. So that is the scenarios that are circled or that they are highlighted on these boxes, and you can see that there is a total net benefit by the year 2050 and the year 2070 under those scenarios. The same thing happened. This is considering a 10% risk of combustible for e-cigarettes. The same thing is true for 25% the risk of combustible for e-cigarettes. So our modeling results suggest that under likely scenarios, the use of e-cigarettes in the population will result in a net public health benefit. Under extreme adverse assumptions, the modeling projects a net public health loss. Some of those assumptions were picked to illustrate worst-case scenarios. And now I'm going to pass this to Dr. Eaton for final remarks.
Well, thank you. And looking at the results from this effort, we think that we've clearly identified areas where we need more and better research to clarify both the short-term and especially the long-term health effects of e-cigarettes in individual populations. And we will talk for a moment about research recommendations. The committee believes that this approach for evaluating health effects of e-cigarettes can provide a generalizable template for future evaluations of this type of evidence. In terms of research needs, which was the second major charge to the committee, there's a lot yet to be learned, but we don't view this as an intractable problem. We think that there's, through the report and identifying major gaps in information, that there are a number of things that can be done to address these gaps in substantive knowledge, as well as a number of areas where there's more research needed to improve both methodologies and quality of our understanding of e-cigarette risks. For example, and just shown here on this slide are a few examples in the report. We have a rather long list of specific research recommendations that we believe will move this field forward, and they include things such as better understanding of the e-cigarette devices and their functioning and the characteristics of the liquid that could be used to inform future product standards. There's certainly need for more population-based studies, including, for example, cohort studies to compare both clinical and subclinical health outcomes among e-cigarette users, and these are especially useful in comparing for harm reduction combustible tobacco users. Observational studies to assess the issue of youth use of e-cigarettes and their subsequent progression to regular smoking of combustible products, and certainly more randomized controlled trials on the effectiveness of e-cigarettes as cessation aids, especially when compared to FDA-approved smoking cessation. And I think the modeling exercise that we did emphasizes the importance of understanding all three areas needed to understand the ultimate health effects of e-cigarettes. So, in summary, while e-cigarettes are certainly not without their own intrinsic health risks, the report finds that they are likely to be far less harmful than combustible tobacco cigarettes. And this is because they contain fewer numbers and lower levels of toxic substances that we know from lots of studies on tobacco products are responsible for much of the harm that's generated from conventional use of cigarettes. And again, we would emphasize, however, while we have intermediate biomarker work in some areas, the long-term health effects of e-cigarettes really are not clear at this point. Using e-cigarettes to help adults quit smoking is an important area for research, and we certainly need to understand this efficacy much better than we do now. And the same is true in terms of looking at the youth and whether e-cigarette use increases the risk of initiating, especially long-term, the smoking of combustible tobacco cigarettes. With that, I thank you for your attention. The report is available online at this website, and now we will entertain questions that have been submitted in writing, and we'll go from there. Thank you.
Thank you, everyone. first question to start us off, if e-cigarettes are viewed or marketed as effective for smoking cessation in adults, what messages can healthcare providers give to reduce the misperception by teens that they are safe for them to use as well?
This is Nancy Brigatti. In terms of cessation for adults, we don't, first of all, the report doesn't make recommendations for smokers, non-smokers, clinicians, or anyone else. It simply makes recommendations to the FDA regarding the science behind e-cigarettes and what's known. As someone who takes care of adult cigarette smokers, I think it's important to tell our patients that quitting smoking is the most important thing they can do for their health, that there are already effective FDA approved smoking cessation devices that we would recommend first, but that this report does support perhaps considering using e-cigarettes. If people do use e-cigarettes to quit, they should not use them dually. They should completely quit. Let me turn it over to Adam to talk about what we would say to adolescents.
Sure. Thanks, Nancy. So this is Adam Leventhal. And so it's important to note that when the committee reviewed the evidence, they distinguish each research question separately. So the evidence on e-cigarette use and smoking initiation was reviewed separately from the evidence on e-cigarette use and smoking cessation. And so those two issues could be disentangled. And a couple of findings, in my opinion, could potentially raise concern. And so if I were to, in terms of thinking about my own children, I would advise them to avoid all tobacco products, including e-cigarettes, because nicotine is addictive and could have harmful effects on the adolescent developing brain, which is a completely separate issue for regarding the public health implications for cessation amongst adults, which Dr. Agati addressed.
Thank you for that. Next question, how does your report relate to FDA regulation of e-cigarettes and nicotine replacement therapy?
Well, this is Dave Eaton. We explicitly did not get into looking at regulations. So really our report provides information on the harmful effects of nicotine itself as delivered in e-cigarettes and a lot of comparative data on e-cigarettes versus smoking, but we did not address the regulatory issue explicitly.
Thank you. Next question. You have conclusions that there is both substantial evidence and moderate evidence that e-cigarettes increase the likelihood of going on to cigarette smoking. Can you explain?
Sure. This is Adam Leventhal. So there was more research out there that addressed the question of whether youth and young adults who use e-cigarettes, whether or not they're more likely to try a combustible cigarette at least once in the future. And so that evidence base was large enough and consistent enough and strong enough to lead the committee to conclude that there was substantial evidence of an association between e-cigarette use and later ever use of combustible tobacco cigarette smoking. So the next question that the committee wanted to address, there was a smaller evidence base about whether youth and young adults who enter into combustible tobacco cigarette smoking via e-cigarettes or not, whether those two groups, once they get started and try a cigarette, whether there are differences in the amount they smoke. And essentially, you know, there was moderate evidence there that they tended, youth who came in via e-cigarettes, once they tried a cigarette, they tended to smoke more frequently and smoke at higher levels.
Thank you. Did the committee evaluate prevalence, health effects, or correlates of, quote, dual use of e-cigarettes and other alternative tobacco products such as hookah or cigars?
It's Maciej Goniewicz here. The task of the committee was to evaluate the health effects. In the introduction to the report, we provided some of the statistics of the most recent statistics when we work on the report about the use and the prevalence of use of electronic cigarettes, smoking, as well as the dual use. However, we did not make any conclusions and based just on the prevalence data that was out of the scope of our report. We acknowledge that this is the pattern that the people are using both products at the same time. That's why in a separate section of the public health consequences of electronic cigarettes, we specifically address the problem of dual users in terms of the harm reduction, in terms of the potential health effects. And that's when we found a different level of evidence depending whether it was full substitution or just partial substitution.
Thank you for that. Next question, how can FDA minimize the possibility of extreme adverse effects?
It's Maciej Goniewicz here one more time. The committee did not make recommendation in terms of how the product should be labeled, regulate, what kind of product standards should be put to the FDA. We provided the evidence of the existing evidence, what is in the literature, to inform FDA on the further steps. But it was not our task to provide recommendation on the regulation of the product. The only recommendation we were asked to do were about the research that might help FDA to regulate the product. In my personal opinion, since we identify in the report certain toxicants, certain conditions of operating the device, they may increase exposure to users of this device. This might be, I hope this might be informative part of the report that can be used to inform FDA, for example, on the product standards. But again, I want to emphasize this was out of the scope of the committee, and this is just my personal opinion right now.
Next question, did the committee look at whether e-cigarettes cause ex-smokers to go back to using cigarettes?
This is Nancy Brigatti. That was among the things that we considered, although it wasn't the primary question that we asked, but the evidence that we found did not suggest that that using e-cigarettes led people to go back to using conventional combustible cigarettes.
Thank you, Nancy. We've been talking a lot about different potential health effects, throughout the presentation. Can you give us an idea of where the evidence is strongest of particular health effects?
Hi, this is David Savitz. Again, in summarizing what I had mentioned is that the information, again, remains quite limited, and the most confident conclusions regard, first of all, the potential, although rare, for explosions or poisoning. There is certainly evidence of dependence, which is fairly strong, substantial, and then some short-term physiologic effects related to cardiovascular outcomes, heart rate increase and increase in diastolic blood pressure. But that's really, after that, there's fragmentary evidence on a range of other short-term outcomes and essentially nothing on the long-term health effects that, of course, we're all concerned about.
Thank you, David. Did the analysis include studies funded by the tobacco industry, or were those not considered?
This is Dave Eaton. Yeah, we looked at the totality of the body of evidence that included reports from governments, published reports from tobacco industry-supported studies across the board, and we did not make any distinguishing between the source of funding in terms of the weight of evidence. We looked at each study and weighed it on its own scientific merits.
Thank you, Dave. We've been getting some questions about e-cigarettes and marijuana use. So did the committee consider effects of e-cigarette use on marijuana or the use of e-cigarette devices to smoke marijuana or vape marijuana?
This is Dave Eaton again. We explicitly did not consider marijuana and the role that e-cigarettes might or might not play in delivering components of marijuana to individuals. The National Academy of Science, Engineering, and Medicine just recently published a report on marijuana use, so I would refer people to that report if they're interested in that. But again, within our charge, we explicitly did not consider the role of e-cigarettes one way or the other with marijuana.
Thank you. Is secondhand aerosol from e-cigarettes just as harmful to breathe in as for conventional cigarettes?
It's Maciej Goniewicz here. So from the evidence that we review, we made a conclusion not about the health effects, but about the concentration and the levels that have been reported in the indoor air. And our conclusion was that there is a moderate evidence that secondhand exposure to nicotine and particulates is lower from electronic cigarettes compared with compostable tobacco cigarettes. The level of evidence here was limited by was influenced by the limited number of the studies that look at the concentration, and we did not find sufficient evidence and reports and studies looking at the health effects of the short or long-term effects of secondhand exposure to secondhand aerosol emitted from electronic cigarettes. That's why the level of evidence here is lower.
Thank you, Maciej. Next question is, did you consider that major cross-sectional studies find youth smoking prevalence has decreased at unprecedented rates in precisely the years that e-cigarette use rose significantly? How did this affect the committee's thinking about initiation effects?
Thank you for the question. This is Adam Leventhal. So the committee certainly did consider cross-sectional population level trends, and we did note that there, especially between 2011 and 2015, there were opposing trends where the prevalence of e-cigarette use went up and the prevalence of combustible tobacco cigarette use went down. And when we look further into the published studies, some of them have been reporting that the prevalence of combustible tobacco cigarette use has been going down for decades, and that there is not a dramatic change in the slope of e-cigarette, or I'm sorry, of smoking during that time. Another important note was that in 2016, prevalence of e-cigarette use amongst U.S. high school students reduced for the first time and fairly substantially from 16 down to 11% from 2015 to 2016. In that period, smoking remained stable. And so because of that, and also because some of the research limitations of these types of designs, including the role of policy or other historical cohort trends that could have a strong influence on the trends, and we couldn't make any definitive conclusions based using that evidence whether or not the prevalence and trends in smoking would have been even steeper if e-cigarette use were not around, or vice versa.
Thank you, Adam. Did the committee find any evidence that flavoring components of e-cigarette liquids can be connected to health consequences of e-cigarette use?
It's Maciej Goniewicz here. In the first part of the report, when we evaluated evidence on the different chemicals and different constituents of electronic cigarettes, there is a separate chapter focusing on the health effects of the flavorings. And yes, the committee looked at the study, the available evidence, and there are some studies suggesting potential harm from inhalation exposure to flavorings from electronic cigarettes. In one of our recommendations for the future research, we recommended long-term studies looking at the different product characteristics, including flavorings, to define the long-term health consequences of regular inhalation of these compounds.
Thank you, Maciej. Next question, if the evidence is so fragmentary regarding potential long-term health risks, why is the committee's conclusion that they are, quote, likely to be far less harmful? Such a conclusion seems premature.
Well, those conclusions are based largely on our this is Dave Eaton, largely on our understanding from a long history of research on tobacco products and understanding the components in tobacco-based cigarettes that cause that harm, and with the recognition that the vast majority of those components are absent in e-cigarette aerosols. But again, we would emphasize that doesn't mean the components that are there without harm.
Thank you, Dave. Did you all find evidence of health effects from third-hand smoke, so residue of e-cigarette use?
It's Maciej Goniewicz here. We did not find studies looking at the health effects of the third-hand exposure to residues from electronic cigarettes. We found some studies looking at the exposure level, and we included our conclusion in the report that there is a limited evidence that electronic cigarette use increases levels of nicotine and some other electronic cigarettes constituents on a variety of indoor surfaces compared with the background levels. That's one of the conclusions of our report.
Thank you. Do the panel members take common liability into consideration when assessing the risk of initiating long-term combustible tobacco cigarettes? I was just asked to repeat the question. Do the panel members take common liability into consideration when assessing the risk of initiating long-term combustible tobacco cigarettes?
Sure, this is Adam Leventhal. In our review of the literature amongst youth and young adults and e-cigarette use and smoking initiation, we had extensive discussions in terms of trying to understand the role of common liability, like such that maybe youth and young adults possess environmental risk factors or maybe internal genetic or psychological factors like being willing to take risk. And maybe that could have preceded both e-cigarette use and combustible tobacco cigarette use and could cause the two to be associated. And so we certainly considered that. And we did find that a number of actually all the studies had covariates or statistically adjusted for the effect of these factors, some adjusting for more than others, and it did reduce the effect estimates, the magnitude of association. So the common liability does play a role if you just look at the correlation on the surface, and then after you take into account that and use other types of research designs aimed to tease apart the common liability from a potential causal risk mechanism, the committee concluded based on the totality of evidence that there's the risk still remained, and there was substantial evidence for ever use and moderate evidence for escalation in smoking frequency and intensity.
Thank you, Adam. What is a reasonable time frame to expect more robust evidence of long-term health effects of e-cigarette use?
This is David Savitz. I think, it's important to recognize that even though, of course, long-term implies that we do need to do studies that address outcomes that are 5 or 10 or 15 years out, first of all, we need to start those soon in order to have that information come in. But it's also important to recognize that once begun, there are intermediate or short-term outcomes that can help inform us in the judgment about long-term outcomes. So by looking at biomarkers and physiologic changes on a longitudinal basis, our predictive ability for the long term gets better and better over time. It doesn't have to wait until the very end of that process to be of value in making a judgment about the long-term health effects.
So did the panel members find any conclusive evidence of similarities or differences between menthol cigarettes and e-cigarettes?
This is Dave Eaton. No, we did not look explicitly relating to the role of specific flavorants, including menthol, although menthol is a flavorant and was considered in the chapter on flavorings. Majay?
Yes, it's Maciej Goniewicz here. That's right. There is a discussion about the role of the menthol in the chapter on the flavorings in electronic cigarettes. However, we did not look more deep in the details just on the menthol. It was discussed as one of the flavorings that is present in electronic cigarettes.
Thank you. We have time for about 2 more questions. What is the state of the literature on the topic of e-cigarette use during pregnancy?
This is David Savitz. We did consider that, and at present there is simply no direct evidence evaluating the impact, certainly in human populations. There is a small bit of evidence from animal studies that suggest that the effects of nicotine are from e-cigarettes would be as expected, but it's really one of those areas where there's good reason to be concerned about the potential susceptibility of the developing fetus, but no information as yet to make that assessment regarding e-cigarettes.
Thank you. And our last question, so bottom line, are e-cigarettes safe?
Oh, this is Dave Eaton. Well, e-cigarettes cannot really be simply categorized as beneficial or harmful. The evidence that we reviewed certainly suggests that while they're not without health risks, they are certainly likely to be far less harmful than tobacco products. And I guess I would say that in terms of the intrinsic harm question of e-cigarettes, that's really the conclusion of the committee. Thank you.
Thank you, Dave. We're just about at noon, so it looks like those are all the questions we have time for today. I realize we got many more questions, so apologies that we didn't have time to get through all of them today. Once you exit this webinar, you will be redirected to our report page, and again, that is nationalacademies.org/e-cig health effects right there on your screen. The slides from today's webinar and a recording of this webinar will be available on that page as well. And with that, I'd like to thank our speakers and thank you all for tuning in today.